Everybody, a beautiful morning
Good
it
morning.
is. The date being Wednesday, May 17th. I'd like to call the order the King County Public Health Committee. I'm Cheryl Strathman, Chair. Clerk, please call the roll.
Juby,
Juby here.
Silva,
Silva's here.
Tarver,
Tarver's here.
Williams,
Williams here.
Young,
Young here.
Sanchez,
Sanchez present.
Strathman,
Strathman here.
Tepe.
Here.
You have quorum in the room.
Okay, in the room. And we also have Mr. Tarver online, who is requested for employment purposes to be online. So do I have any objections to him being online with us this morning? Okay,
No,
great.
Madam Chair.
Pardon me?
No objections.
No objections. Okay. Okay, Mr. Tarver, you've been granted a voting in our voting sessions this morning. Okay, so and do we have everybody on board? Let's see. Good morning, everybody online. First, we have the public health finance reports. They are attached. Do we have somebody presenting? Hello?
We don't typically get a presentation, Madam
Okay,
Chair.
good.
It's just if anyone has questions, Canel is typically around to answer.
Thank you.
Yeah,
Thank you.
but I would like to move unanimous consent to approve the minutes.
You
Of-
can't hear you.
My mic on? Oh, yeah.
There
Yeah,
we
you guys
go.
hear me now? The time is now, what time? No, I'd like to move unanimous consent to approve the minutes of April 19th, 2023.
Okay, can I have unanimous consent for the minutes?
Yes.
Okay, great. Okay, and so now I stand corrected that the public health financial reports are attached, if there's any questions. And I would like to go to public speakers this morning. Do we have a Kenneth Lobel in the room or online? Not online. Okay, maybe he'll come up in a little bit. Lori Powell. Good morning.
Good morning. Hi, I'm Lori Powell. I'm a Kane County resident, been here almost 20 years.
Excuse me for interrupting. Can I ask you if this is on agenda or off agenda?
It's regarding last month's meeting. So I don't know, is that off agenda?
It would be off agenda, so
Okay.
you'll have 3 minutes this
Sure.
morning. Go ahead. When you're ready.
Okay, so I emailed this entire board, and I will just basically reiterate what I emailed. On April 13th, 2023, I attended the monthly Public Health Committee meeting. Mr. Michael Isaacson, the Executive Director of the Kane County Health Department, gave your committee an update. On the first page of his PowerPoint, there are COVID updates. He reports that Paxlovid is being underutilized. I find this statement very concerning. Paxlovid is an antiviral developed by Pfizer and was approved for emergency use authorization only as of February 15th, 2022. I have included documentation of Paxlovid that raises significant safety and effectiveness concerns. There are other proven antivirals that remain safe and effective prevention and treatment. And I provided a fact sheet from Truth for Health Foundation with 10 sources of information supporting that they cannot ethically recommend the use of Paxlovid. So my questions to the board and to Mr. Isaacson, and I'll clarify in my letter, I said expecting answers meaning next month, at the June meeting, not today. Is why is Paxlovid being prescribed to the Kane County residents? Are you aware of the ineffectiveness and lack of safety regarding Paxlovid? Are residents given proper informed consent about the dangers of Paxlovid? Are other safe and effective alternatives such as ivermectin prescribed to the Kane County residents? And so, like I said, I look forward to receiving answers at next month's meeting. Thank you.
Thank you. And now we have Dr. Sherry Bresnahan. Good morning.
Good morning. My name is Dr. Sherry Bresnahan. I hold degrees in chemistry, biochemistry, psychology, biology, and a chiropractic physician. On January 11, 1999, Times front cover stated in a special issue, "The future of medicine, how genetic engineering will change us in the next century." American, French, Chinese, and Italian researchers independently have discovered that patients that died due to COVID-19 had high levels of a particular enzyme, phospholipase A2. This enzyme has similarities to an active enzyme in pit vipers. When the activated enzyme circulates at high levels, it has the capacity to shred the membranes of the organs. The earliest PCR test used for distinguishing venoms was July 2001. It is the gold standard for anyone working with venom identification, PCR. A British study found toxin-like peptides in plasma, which is blood, and fecal samples from COVID-19 patients, but none from any of the controls. What they found were 36 animal venoms. One was a crown of thorns starfish toxin, 20 snake venoms, 5 conotoxins, which are from cone snails in the ocean. The COVID-19, the researchers deduced, was a weaponized venom, disease process triggered by venoms. The venoms are synthetically made in a lab. Not only can you order up your toxin, but you can order what medium, the cell tissue that it is grown in. You can have E. coli, which is a bacteria, yeast, and mammalian cells. The United States Patent Office, patent 5969096, the conotoxin from the cone snails were created by a number of named inventors, and one of the assignees that got this product was the Salk Institute for Biological Studies. That should ring some bells. Polio vaccine. It was filed June 26, 1998. It is acknowledged in this patent that the peptides of the venom toxins are of such length that they can be chemically synthesized. What can you do about all this? NAC, EDTA, glutathione, and vitamin C are some possibilities to help rid the body of the phospholipid lipase A2 enzyme from the venoms. To
Dr.
rid the
Bresnahan.
body of the bromelain, you can use bromelain, aloe vera, and resveratrol to get rid of the bradykinin, which is also in the venom.
Dr. Bresnahan, we need you to wrap up now.
I'm done.
Okay, thank you.
That's a 2-hour presentation done in 3 minutes.
Well, that was impressive.
This is all, not all, this is just some that I did for the 3 minutes.
Thank you.
Thank you.
Okay, Roxanne Shulka. Is this on agenda or off agenda?
I'm not sure. I'm going to be talking about your recommendations on the website.
Okay, that would be off agenda, so you have 3 minutes.
Okay. All right. Well, I apologize if you've already updated it, but the principles remain the same. So I'll continue. I'm going to talk about law, rights, and responsibilities. The Constitution acknowledges that our rights are God-given and inalienable. The government's purpose is to protect our natural rights. Our founding documents were written according to negative law, which means thou shalt not. It restrains evil, protects life, liberty, and property. Beyond that, you're free to live your life as you please. Positive law, on the other hand, forces citizens to conform to the dictates of government. In real life example, negative law states that you can't harm someone or take their life. Positive law says it's the government's responsibility to keep you safe and healthy. So when you cede your rights to the government to keep you safe and healthy, you've lost all control of your life. And that brings me to my point of your website and recommendations. So that same principle that applies to our federal government also applies at the state and county level. Okay, the law says that only a licensed medical professional is qualified to give medical advice. And I know when you have recommendations on your website, you're not quite crossing that line, but you do carry the weight of a governmental body. So what I would rather see on your website is that Kane County is a resource. You're not a mouthpiece for big pharma. You give both sides of the story, and include true, uncensored information so that individuals can make up their own mind as to what medical interventions, and obviously I'm talking about COVID and the shots, but I would even go one step further. Rather than giving, in addition to giving the whole story, some people have been coerced into taking the shot that they now regret. There are protocols that tell you what you can do to detox and how to get your body back to what it was before and be healthy. So again, what I'm suggesting is rather than you being a mouthpiece for one viewpoint, that you be a resource and let people make up their own mind. Thank you.
Thank you. Okay, as we move on, we have animal control reports this morning.
Good morning, everyone. I'm very short. All my reports are on file. If anybody has questions, please feel free to ask me. Our next vaccine clinic is next Wednesday, the 24th from 4:30 to 7 p.m. We're very excited about that. And IDPH just released some statistics yesterday that I received, and I was very excited. I wanted to bring them to you. The last rabid cat in Kane County was in 1983, and the last rabid dog was in 1966. I just thought that was very interesting because, again, we keep ensuring that these animals are safe, which keeps the people safe. So I just thought that was fascinating information to bring forward to you guys today.
Good job.
If anybody has questions, please let me know.
Any questions?
I have a statement. Kudos to whoever's running your social media. I'd love to see a little more of it, but they're very heartwarming stories. So I think that's going to touch some hearts.
Thank you. It's actually done by our shelter manager, Cam DeBoer. She's phenomenal at creating those stories, and the way she gives them scripts, and they love long walks on the beach, things like that are just amazing. And I give her full credit for everything she does to our social media stuff.
Oh, please thank her for me. Thank you.
Sure will.
Okay, any questions? Thank you.
Thank you.
Okay, and now, we have our director, Michael Isaacson, online with us this morning. Good morning, Michael.
Good morning. How's everybody doing today? Oops, can you hear me, Cheryl? Oh, good. You're here. Okay, very. It was just a delayed response to the question. Very good. Well, thank you. Next slide, please, Blair. So I wanted to start off today and just acknowledge all of the nurses who are working in public health around the country, but specifically our great team here at the Kane County Health Department. Last week was National Nurses Day. Just a little insight into some of the things that people do. We have nurses who are engaged in our home visiting program and coordinating with other home visiting programs around the community. For those of you who aren't familiar, home visiting, where we go and work with young mothers, is one of the best, with the strongest evidence-based interventions, in my opinion, that we can do for our community. And a lot of times people who may be raising children may not have had great modeling themselves, and being able to have somebody come into their home and really be a support for them has shown through evidence to really increase positive outcomes later in life. It's a great violence prevention program for later in life. It's a great program to reduce the likelihood that that young person, excuse me, is going to come into contact with law enforcement. Those are things that happen, 10 years later, but immediately we continue to get positive feedback from the families that we work with, just the support that they get. We also have nurses who work with our lead program, both we have environmental specialists, but also on the clinical side, nurses in Kane County. And we'll talk more about this in future meetings. We do have a lot of old houses, which means we have a lot of lead paint still around. This can be very dangerous to the development for young people. So we have very active programs getting out there trying to work with families and protect them from lead. We also have nurses who work specifically with our highest risk infants. So that means everyone born in Kane County, they're assessed. And if they have certain conditions that may put them at developmental or health risks, just like with the home visiting, we have a nurse who will connect with that family and provide additional supports. We have several nurses who are very active with our vaccine programs. If you look out over the past 100 years or so, one of the biggest things that's led to the increase in our longevity here in this country is the advent of effective vaccines. So it's really important that we have these opportunities where our nurses can get out there and be providing vaccines to children to keep them safe. Many of the things that 50 or 60 years ago, just a generation ago, were very scary for many families. We've been able to push those back. So we don't hear about polio in our community anymore. We don't hear as much about measles and mumps. But unfortunately, we're seeing pockets where people are not vaccinated. And around the country, we've seen resurgence of measles and mumps. So we have to really make sure that we're getting out there, and our nurses do a great job of making sure that that's happening. So it's a wide variety of things. We have nurses who are working and following up and investigating communicable diseases. So this is very important. So using something like measles, even though that doesn't happen very often, if we have somebody who's potentially exposed, our nurses and their support team really will work with those families to make sure that we're able to stop the spread of those diseases if they do occur in our community. So overall, our nurses, public health nurses, it's kind of a Swiss Army knife position to be a public health nurse, and people have a tremendous skill set. So last week was just one opportunity to thank them. You can see all the names of the great folks we have working at the health department here. So I just wanted to give them a special shout out. Next slide, please. And then also last week, of course, the public health emergency in the United States for COVID came to an end on May 11th. And the governor made May 11th Illinois Public Health and Healthcare Hero Day. So for this, I'd like to turn it over to Chair Strathman to say a few words. Thank you.
Okay. Well, as Mr. Isaacson, I always want to call you Dr. Isaacson. Maybe it's a premonition. Last week, as you were saying, was the end to the pandemic. And so I just have something I want to say to all of our public health workers. Last week, May 11th, 2023, was the official proclamation of the end of the COVID-19 pandemic. And although COVID has not completely gone away, and we still need to be aware of the challenges, I would like to take this time to recognize our great staff at the Public Health Department. A simple thank you is not enough to express our gratitude for your service during these last 3 years. COVID affected us all in so many ways, medically, mentally, and socially, and in so many ways we didn't expect. Working from home, Zoom class meetings, Zoom meetings, Zoom game nights, Zoom family nights, Zoom graduations, check-ins with loved ones, drive-by birthday parades, graduations, and celebrations, trying to come together as a community while still social distancing, learning to replace hugs and handshakes with elbow bumps, wiping down deliveries before we brought them into the house, finding ways to stay connected while still staying safe. As much as we asked of our citizens, we asked so much more of you all. You rallied, challenged, brainstormed, came up with solutions, tried them out, tweaked them again and again, and made them work. You did so much more than we can all know. Your work as a team to organize vaccine sites, from securing the facility, figuring out how to set them up, organize them, and who should administer the shots, who should be the first to receive the shots. You educated us, tried to comfort us, listened to us, worked for us, many times without our cooperation because we were scared. You were asked to carry an unfair burden. You dealt on a personal level with all of the stuff that was going on for all of us, while also taking on the professional mantle as well. Your courage and devotion to your craft has been outstanding, and most of us will never comprehend all you were asked to do and all that you did. There are no words enough to convey our thanks. Where would we be without you? Thank you for every minute, every hour, every day that you worked to prepare our community. Thank you to our heroes for your dedication in keeping us all healthy during the pandemic, for your countless hours of hard work, and we are indeed filled with gratitude for you. And if I'd have my way, I'd be Oprah and tell you all to look under your chair and find a car. I wish I could. So thank you again.
Is there anything under the chair?
Pardon me?
Is there anything under the chair?
There's not anything under the chair. I
don't-
apologize. I apologize. I wish there was, but then I'm not Oprah either, so. Okay. Mr. Isaacson, back to you.
Great. Well, thank you so much for those kind words, Cheryl. And I mean, I know seeing firsthand just how hard everybody worked at the health department over the last few years, and certainly our hospitals and our clinics and our first responders. Like you said, this included everybody, but it is nice to get the special recognition on the public health folks and the healthcare folks. So thank you very much on behalf of our staff. Next slide, please, Blair. So I showed this last month, but just want to give a reminder that coming up on May 23rd, we do have a youth mental health event. We have some great speakers. You can see Dr. Susan Mrazek is one of our staff members at the health department. She's a PhD community psychologist, and she's an excellent speaker and has tremendous expertise in working with the very young around mental health issues. It looks like it's going to be a fantastic day. So if you have interest and want to join, I would encourage you to sign up. It is going to be simultaneously interpreted into Spanish. So we will have headsets available for people to get that. And also we will be making childcare available. So just a couple things that we're doing. We really want to engage the community, and we want people to be able to participate. Childcare is frequently listed as a reason why our community members can't join. So we're trying to knock down some of those barriers. And then of course, with the highest Latino population by percentage in the state of Illinois here in Kane County, we really have to make sure that we're making things available in a language that is most comfortable for the person. So I encourage you to join that. And with that, I think that's the end of my presentation today. We do have several resolutions, so.
Okay. Any questions? That sounds like an interesting day to be able to visit. I'll have to check my calendar.
Madam Chair.
Yes, Mr. Young.
Mr. Young, I had a question for Mr. Isaacson. It came to my attention that some of the school boards were receiving money for each COVID dose by the pharmaceutical companies. I'm just curious, was the Kane County Health Department or any individuals compensated for each dose of a vaccine given?
No, I'm not familiar with that. Now, I'll also turn to our directors, Laura Barrett and Uche Onwuda, but I'm not familiar with the schools being compensated in that way, but definitely the health department was not compensated in that way.
Okay.
Uche or Laura, do you have any insight in that?
I'm not familiar with any compensations by any entity.
Okay, thanks.
Okay. Any other questions? Okay, so we do have some resolutions this morning.
I do
Madam
see
Chair.
Mr. Tarver has his hand up.
Pardon me?
Tarver has his hand up.
Oh, okay, Mr. Carver, I'm sorry. Thank you.
Thank you. I just wanted to say thank you, Director Isaacson, and all the work that your team is doing. We really appreciate that. A comment I have regarding that program on May 23rd, wondering if there's an opportunity for an evening or perhaps a Saturday event to help those families who obviously, go to school is still in session, or an opportunity for a weekend to help with that opportunity. That might increase participation. Not sure if that's happened in the past, but just a suggestion.
Yeah, that's an excellent suggestion. Thank you. And we do run ongoing events for parents. We're really focused in Aurora and Elgin, but we're trying to expand that right now. As a matter of fact, I think we may even have one coming up this evening or tomorrow night. So again, just like the language and the childcare, we have to offer these things when it's convenient for people. So if people are working regular jobs during the day, isn't always the best. So we're definitely doing things in the evening on weekends. But yeah,
Appreciate
great
it.
comment. Thank you.
Thank you so much.
Good suggestion. Okay. Now, Michael, do you want to present the resolutions?
Absolutely. So we'll start with the first one, and I don't know that this not necessarily needed to be a resolution, but just in terms of transparency, my preference is always to bring it before the board. We do have several positions that have been critical for us over the last couple of years, and we've identified that they remain critical, but they're seasonal positions, and our needs exceed the county's 600-hour cap for seasonal positions. So what we'd like to do is we're going to be transferring those positions from seasonal into full-time positions. So again, as a department head, I could do that unilaterally, but prefer to bring it to you just so you know exactly what we have going on. So we do have 4 positions that we're going to be changing from seasonal into full-time with this resolution, and just wanted to bring it forward to you. If there's any questions, I'm happy to answer them. This particular resolution, we're not increasing headcount because those seasonal positions are already included in our headcount. They are budgeted. And again, for people who are newer, because we're largely grant funded at the health department, anytime we hire people into grant positions, we make it very clear that these are grant funded positions, and that if the grant funding goes away, there's a strong likelihood that the position will go away. So I don't have fears of us becoming a bloated organization with this, but actually in our assessment, in this case, it's 2 positions really helping with communicable disease follow-up, and then 2 positions helping with administration and finance that we've deemed to be absolutely critical to maintain. So happy to answer any questions anyone has.
Okay, could I have a motion and a second?
Silva moves.
Silva moves. a
Sanchez
second.
seconds.
Sanchez seconds. Are there any questions for Mr. Isaacson? Yes.
Mr. Young, so COVID-19 is considered to be over, according to last week. And so it appears that this resolution was possibly drafted prior to that happening. So is it really necessary to have this additional staff on board? I can see it being necessary a year ago where you had all that chaos happening, but I'm just questioning a week after that.
I mean, sure. Yeah,
Yes,
no,
go
that's
ahead and
an
answer, please.
Yeah, that's an excellent question. Thank you, Mr. Young. And this is not so much based on an ongoing burden of COVID. for all 4 of these positions. This is something that we're looking at just for the ongoing burden of us managing communicable diseases in our community. So over the last couple of years, even before COVID, it's my assessment that our communicable disease staff has actually been understaffed and has needed additional resources. So it just so happens that we're talking about it here now, at the tail end of COVID. But as we look at things like monkeypox or mpox, as we call it now, we do have cases of tuberculosis still coming in. We're seeing an increase in STD cases in our community. There's a lot more that we could do to reduce those. So this isn't because we're worried about, even though COVID's not over, this isn't focused on COVID. This is just an ongoing need that we need to really make sure that we're doing everything we can to protect our residents. But that's an excellent question. Thank you.
Yes.
Director,
Silva.
Dr. Silva, can you talk a little bit more about that increase in tuberculosis? Is it a,
Yeah, and I
how
don't.
big is that? How big?
Sure,
how
and
many cases?
not necessarily an increase in tuberculosis. There is an increase in STDs, but we do have a pretty active TB program here in the community. If many of you may remember, was it about, I don't know what, Uche, 10, 15 years ago, we had one of the largest outbreaks in the country. So our staff is keeping very busy, and with something like tuberculosis, where we're providing, if you're not familiar, we provide medication to people through something called direct observed therapy, where we actually monitor people to make sure that they're taking their medications to keep people safe. But I don't know, Director Onwude, anything else, or Director Barrett, anything else you want to say about either one of those?
Yeah, just to give you an example, how our communicable disease program runs. If you remember, I think about a year before COVID it started, this I think was in 2019, we did not have a case of measles. We had an exposure of somebody from another county in our hospital, and that sent us on a tailspin, disrupting services for all the other departments, because we're a very small communicable disease program. We have one person who addresses STD. We have one person who addresses general communicable diseases. We have one person who addresses outbreaks. So as you can imagine, we have thousands of cases that come in on a daily basis. Just for an exposure in our county of measles, we had at least 200 people that we had to check their vaccine history. We had to call, do all the case investigation and contact tracing for the measles case. So every time there's an outbreak, if there's a food outbreak, we have to bring in environmental health people. We have to bring in some nurses from disease prevention. We're not able to handle it on our own. So there has to be a limit to how much we can disrupt other programs just to be able to address outbreaks in our own division. So outbreaks in the community. So I think we're moving in the right direction with this, so that we can sustain the services that are required for communicable disease.
Thank you.
Any other questions?
Mr.
Young
Young,
again?
Mr. Young, the measles outbreak, you had to check the vaccine history of the people, but were those people coming from other countries that were not vaccinated? I'm just curious. Everyone is supposed to get a measles shot when, whatever, you're 7 years old or something, and it lasts you for your lifetime, to my knowledge. But if there are that many outbreak of measles, how did that happen? And were those people not vaccinated previously? Or were they potentially people coming in from our southern border, perhaps? I don't know, just curious.
Okay,
Do we have that information?
Yes, like I said, this case, we did not have a case. We had an exposure. A case was in one of our hospitals. So because that case was in our hospitals, we had to consider the exposure of people who came to the emergency room, the nurses and everybody who had attended to them. Wherever, when you do case investigation and contact tracing, you have to consider where they've been, did they travel, or were they in the area? Did they go to Chicago? Then you have to do case investigation on everybody that they came in contact with, depending on the disease. And I've been at the health department 20-something years. I've seen MARS, I've seen SARS, I've seen all kinds of, every year there's now Mpox, there's COVID, there's always something new coming up. And I've never seen any time that a disease was taken away, it's added on to what we already have. So we have to prepare for the future, and the future is now where we are right now with foodborne disease outbreaks, we have in the restaurants, if we have an exposure that's more than 10 cases, we're going to have to bring in people from other divisions to help us because, we're clearly understaffed.
Mr. Young, again, my question is specifically about the measles.
Okay.
Because if you're vaccinated, and I'm not a doctor, if you're vaccinated, you shouldn't be able to get measles, even if somebody comes in from, let's say, out of the country that has measles. So you just mentioned a couple of minutes ago, there were 200 cases of measles. I'm just curious where that came from.
I did not say that there were 200 cases of measles. I said there was one case of measles in one of our hospitals and over 200 people were exposed to that case, meaning that those people had a chance of coming down with the disease.
How could you come down with the disease if you had the measles shot?
Well, as we know, not everybody is vaccinated. The only way we can tell whether they're vaccinated is to check their vaccination history. So somebody has to call the doctor's office, call the family to find out whether they're vaccinated. And if they're not vaccinated, we have to quarantine them for the length of time. So there's a lot of work that goes into all that. We don't just take their word for it because some people would say that they're vaccinated so they can get back to work and they're really not. And some of them may have been inadequately vaccinated, so, going through the paperwork at their doctor's offices, it was stressful. We had to pull down everybody from the different divisions to help us with that particular outbreak. And not to talk about the TB outbreak, which about 1,600 or so exposed. That took a long time.
I think Mr. Young understands that there was a lot of work on your part. I think his question is specifically about the case of the measles and whether or not that person was vaccinated.
Correct.
Is that what you're saying?
That case number one, case number zero, whatever that person number one, Ms. Juby wanted to say something. She's had her hand up.
Yes, Ms. Juby.
If I could, there are parents in King County who choose not to vaccinate their children for whatever reason.
Okay.
And so a lot of the diseases that we thought were eradicated, we're now seeing, and it's not just in King County, it's across the United States. We're now seeing those diseases being reintroduced. And it's not solely because people are coming in who haven't been vaccinated, because parents are choosing not to vaccinate their children. And that's what we're seeing. So
Gary Doherty, could you please mute? Okay, he just said. Thanks. You're right, that people are like that. Okay.
Yes, Mr. Sanchez.
Thank you, Madam Chair. Yeah, and another thing is no vaccine is 100% effective. So I think measles is somewhere around 95% effective. There's even amongst the vaccinated, there's going to be some that when
variants.
exposed could get it and could spread it.
Right.
And I think it's important to note as we talk about this, where the work really is. So let's use this measles case that we were talking about. There's 200 people potentially exposed. Just like with COVID, and I think all of America's learned more about infectious diseases over the last few years than probably they wanted to. But in this measles case, Those 200 people were already exposed. Our role is not to go in and protect them. That's really for them and their healthcare provider, that they're going to seek treatment depending on what the disease state may be that's appropriate. What we're doing is making sure that those 200 people don't pass measles on to someone else. So that's why the tremendous workload is so high, because for every person who's exposed, we need to check, as Director Onwuda said, have they been properly vaccinated? If yes, with the case of measles, then our concerns are more alleviated, even though, as Mr. Sanchez said, all vaccines are not 100% effective. But we also need to see if somebody's not vaccinated, then we need to quarantine them. And again, depending on what disease it is, the length of time that we're going to ask them to stay away from other people, not to protect them, they've already been exposed. But in case they develop disease, we don't want them passing that on to somebody else. And if we have about 5% of our young people who are not being vaccinated for a variety of reasons, 5% of the population of Kane County is a lot of people. So you have vaccines aren't 100% effective. Everybody's not getting vaccinated. Vaccine immunity can wane. So for diseases like measles, where we've largely pushed it out because of effective vaccine campaigns, we still have people who may have been vaccinated a long time ago who may not have the full protection that they may have had 20 years ago. All of that requires person power. So again, regardless of COVID, since I came into this role, my conversations with Director Onwuda have really been around what do we need to do to make sure that we're able to manage communicable diseases. And regardless of COVID, we identified that we needed additional support. COVID happened to give us some resources where we were able to bring on some temporary help. Now we have resources, we're able to turn that temporary help into permanent help. And again, I think this is going to be very positive for the residents of Kane County.
So that brings us back to the resolution. So does everybody understand now why we're needing this? Okay, we have a motion and a second. So clerk, please call the roll.
Juby,
Juby, aye.
Silva,
Silva, yes.
Tarver,
Tarver, yes.
Williams,
Williams, yes.
Young,
Young, no.
Sanchez,
Sanchez, yes.
Strathman,
Strathman, yes.
passes with 1 no.
Okay. And could I have a second and a motion and a second for the next resolution for discussion?
Silva moves.
Sanchez seconds.
Silva and Sanchez. Michael?
Sure. So for this particular resolution, we are asking permission to increase head count by 2. We do have grant funding to pay for this. Again, me still being relatively new in my role, one thing that we've looked at is as we've assessed how our department operates, we feel that we could provide more support for our program people with grants, especially since we're predominantly grant funded. If we had additional supports in our finance department to help us with that. So we have grant funding. This will require us to do a budget adjustment with the state where we're able to pay for this right now. Once this grant funding is over, I'm comfortable that we'll be able to find additional funding to keep these positions moving. But we are asking to create a grant operations specialist and a finance operations specialist that can help on the back end to really support our program staff as they're implementing their important work.
Okay, any questions? Okay, staff, please call the roll.
Juby,
Juby, aye.
Silva,
Silva, yes.
Tarver,
Tarver, yes.
Williams,
Williams, yes.
Young,
Young, no.
Sanchez,
Sanchez, yes.
Strathman,
Yes.
passes with 1 no.
Okay, moving right along. Michael, you're up again.
Great. So our final resolution today is around interventions that we're putting in place in the community to address the opioid epidemic. We are asking permission to enter into 6 agreements. We do have grant funding for all of this, both from the Illinois Department of Human Services and also from the National Association of City and County Health Officials. One of these projects is the effort that we're doing to embed peers in our emergency departments. So this is an evidence-based intervention that I've spoken on before. We are engaged with all 5 of our hospitals as part of this, and we do have grant funding specifically to provide to the hospitals to help them with this. So what we'd really like to see globally, at a holistic level, is everywhere where we may come in contact with somebody who's an active drug user, what are we putting in place so that we can hopefully get them into treatment? If somebody comes into the emergency department because they overdosed or because they're with someone who overdosed, we want to make sure that we are supporting our hospitals so that they're providing the appropriate medications, because there's very effective medications that can help people as they ease from active use into recovery. Having a peer, which means somebody with lived experience that can be there to talk to that person to help them navigate the system and hopefully get them into treatment. As I mentioned, that's proven to be highly effective around the country. So we're doing more to support them and working with community organizations. And then we're also looking at where are the barriers to treatment. So, there's no doubt, and whether we're talking in this case, emergency departments, but also I'll include our fire departments and our police departments. It's hard to work with people who are active drug users, and it can be frustrating, and people who may be in the throes of active drug use may not be the most polite people to work with. These first responders may be fatigued from seeing the same people over and over. Those are facts. But it's also a fact that if we can get an intervention in place at the right time, that maybe a year from now or 2 years from now, that person that the fire department was picking up once a month or twice a month, that person may be past that. They may be in recovery. They may be back to living a more normal life. So first, we want to keep them alive. But 2, we want to make sure that all of our residents have an opportunity to really live a full, fulfilling life. And we have plenty of people in recovery in our community who can tell the story about how tough it was when they were struggling with drug use. But getting that little bit of support from somebody at just the right time can really help make a difference and literally change somebody's life. And again, we're talking about our kids, we're talking about our siblings, we're talking about our family members, our neighbors, many people, our parents. And so we can help them, we can get them back into a place where they can be an effective parent again. So this is really important. This emergency department intervention is really key. So we have $50,000 of grant funding for each of our 5 hospitals. That's $250,000 in the resolution. And then also we're finally ready to launch our communications campaign around this. So this is something that's been talked about not only at this committee, but also at the full board, where we're looking at doing videos. We're looking at really telling stories. We have multiple different audiences that we're trying to reach. So we want to reach active drug users. We want to tell the story about what's happening with our treatment organizations. We want to use that to try to parlay it into more cooperation from our organizations. Because there's a lot of people who are involved in this, but I'm a public health guy, I'm a data guy, but story is really how you move people. So what we want to do is really increase our ability to tell the story about what's happening in the community, give people hope, not only for the people who may be stuck with a substance use issue at the present moment, but also to provide more support for all the families who are struggling, because it's very difficult to have somebody in your family that's struggling with substance use. The ripple effect of the impact of that's very big. So we have an $85,000 campaign that we've laid out, which includes videos, social media, news stories, getting it all out to people. So that's what we're asking for with this resolution is for those 6 contracts to be able to move forward.
Thank you. Do we have any questions?
Madam Chairman, this is Alan.
Yes, Miss Allen.
I just wanted to say that this is another example of how you try and save lives one at a time, which is the most expensive way to do it, but is usually the most successful way. Our mental health court and our drug courts both work that way. And I've attended those graduations, and they frequently have the graduates speak, and the graduates say something like, I didn't know where to turn. And the effects that I had on my family, my children, my parents, all the people that my particular disease affected were just devastating until finally I had a chance to turn my life around. And sometimes at drug court, someone says, this is a 2-year program. It took me 5 years, but here I am, I'm graduating. And the stories are so real, and you can see how truthful they are. And the audience is always filled with the graduates, friends, and families. Over in the Jobs Committee, we have workforce development and we have a homeless section. And one of our people has said, if you can get to someone just before they're homeless, if just before they are evicted, while they're looking for the next job, if you can give them some support to get through that couple of months where they get into the next job and they're not made homeless, then you can save that whole family. And so this is the kind of, I think, enlightened and interactive work that the county does to try and reach our most vulnerable people and bring them back into our communities. And it's, we are not on those front lines. So thank goodness we have experts who are looking for opportunities to help our neighbors. We don't necessarily know who's in crisis, but if we have ways to reach out to them, such as Michael's programs, then it's just a better community for all of us. Thanks for letting me talk.
Thank you. And I think the ultimate goal is to bring them back into the community to be a contributing member of society rather than a burden on themselves and their families. And it does affect so many more than just the person who's getting the direct attention. It's a societal situation. Okay, so we have a motion and a second, and yes, I thought it was Dr. Silva and Mr. Sanchez. I'm making everybody a doctor this morning, so. And in the health, Dr. Young, we'll just go right on down the line.
Sure.
Okay.
It's an honorary title.
Honorary, that's right. Okay, so clerk, please call the roll.
Juby,
Juby,
Silva,
Silva, yes.
Tarver,
Tarver, yes.
Williams,
Williams, yes.
Young,
Young, yes.
Sanchez,
Sanchez, yes.
Strathman,
Strathman, yes.
passes.
Okay. We do have one more resolution before us this morning, and that is, I'd like a motion and a second for authorizing the number of procurement cards.
Williams moves. Sanchez seconds.
Okay, Williams and Sanchez. Can I have a roll call? Any questions first before we?
It's the
Take a roll
same
call?
thing we've been doing with every other.
Yes, it's
Okay.
basically just
Yeah.
updating and housekeeping and that sort of thing. So any other questions? Okay, call the roll.
Juby,
Juby,
Silva,
Silva, yes.
Tarver,
Tarver, yes.
Williams,
Williams, yes.
Young,
Young, yes.
Sanchez,
Sanchez, yes.
Strathman,
Yes.
approved.
Okay. Okay, do we have any old business before the board this morning, before the committee? Anybody? Okay. And I'd like to have a unanimous motion to replace the reports on file.
Williams moves unanimous motion to place the reports on file.
Thank you. Do I have a unanimous? Okay, thank you. And I don't believe we need an executive session this morning. So, and now new business. Is there anybody with, yes, Mr. Young?
Mr. Young, I have two new business.
Okay,
This was an email sent to me by a Kane County resident. I'm just going to read part of her email. And it has to do with, and this has been brought up with a couple of the speakers about how the World Health Organization, the WHO, United Nations, they have all of their logos on websites and videos. So I'll just read this. We know that the World Health Organization is a subsidiary organization of the United Nations, not the United States. We know that the vaccines have been associated with deaths, heart problems, cancers, and many other adverse consequences. We also know that the World Health Organization has no governing authority in the United States and that serving their interests ahead of the concerns of local taxpayers in Kane County is a violation and a dereliction of duty. Please have the board take the necessary procedures to approve removing all references to the United Nations and subsidiaries such as World Health Organization. And I'd like to make a motion. I make a motion to formally ask the Kane County Health Department to remove all references to the WHO, United Nations, and any other non-United States organization. Can I have a
I'll
second?
second for discussion purposes.
Okay.
Okay, so I don't think we can do that this morning because it's
Can't.
not on the agenda, correct?
Yes,
So we
correct.
can't, we can discuss, we
Oh,
cannot
we-
vote.
Correct.
Right.
Okay, that's where I was going. So
Okay.
we can discuss this. So I'll open the floor for discussion. Does anybody have something?
I guess I'd be interested to know what the purpose of these references are. What's the benefit to us? Why are they there?
Why is the,
Why is the
Well,
WHO even listed
Yeah.
anywhere on websites and,
on any part of the website you're saying?
yeah, and even out there on the screen, when it scrolls, it says wash your hands and all this other stuff, and it has the WHO logo everywhere. And the point that she has given to me is that we shouldn't be subservient to the World Health Organization. We're the United States of America. Why are we even referencing wherever they're located, Belgium or whatever?
You know, the only thing I would say is, I think because we follow a recommendation doesn't mean we're subservient, would be my only comment about that. But I hear what you're saying. And I think we can talk about this and see what we
So
want.
how would it work to put this on the agenda so that you can vote for that? What's the procedure for that to happen?
That's a great question. Ms. Stube.
So because you brought it up in new business, you can work with the chair to have it put on the agenda for the next meeting. I would imagine you would need to work with a possible resolution to present. But because you brought it up in new business now, we can have a conversation, but you need to work with the chair to get it put on the agenda. And if your purpose is to have a resolution that's requiring all of Kane County from removing those resolutions or from removing those references, then you'll have to, I don't know who would be the person that would help you write the resolutions, but that's what you would present to the chair, and that would be what would be on the agenda and what would be discussed with the committee, and then the committee, whether they voted to send it forward or not.
Okay.
Or actually, we probably, even if it didn't pass, it would still go forward with a vote of not recommended to the executive and then the full board.
Got it. To make it, but to call a vote, there has to be something on the agenda.
Correct.
So I need,
Yes.
and if it's a resolution that I would like to see, then I need to work with
With-
Jamie Musser or somebody to draft that, or I'll just send you an email.
We'll figure it out.
Okay.
And how to proceed with it, because this is new for me as well.
Okay.
To how to do this, but we'll figure it out
Okay.
and go from there.
Thank you. And my second thing.
Yes, sir.
Can I interject real fast? This is Director Isaacson. I just want a quick
Yes.
comment. So the Kane County Health Department derives much of its legal authority through the Illinois Department of Public Health. We do get our guidance from the Illinois Department of Public Health, and the Centers for Disease Control is where the majority of our information comes from. So I don't think it's problematic to say that most of our guidance, or almost all of our guidance, is coming from US sources. And in fact, that's where our authority comes from. One caution though for something like this is in the case of a pandemic, by definition, it means it's worldwide. So it's not a US thing, it's a worldwide thing. So people may have seen that last week, the World Health Organization also declared an end to the COVID emergency. We are not an island, and we do depend on research and information from countries around the world. So even though our guidance, I don't disagree with Mr. Young, our guidance truly does come from US sources, but valuable information still comes from other countries around the world as we navigate these things together. Certainly with international travel, it's imperative that we're all working together. So that's the only caveat I would put out there, is there may be cases where we are getting information from organizations such as the World Health Organization about what's happening in other places in the country that's not on U.S. soil, that still may be impactful in terms of how we're doing planning. But our authority is all U.S. based, and we're certainly not subservient to any other countries. Thank you.
Okay,
Thank you.
thank you. And the second thing I've got real quick.
I would think
Okay.
before we go to that, Mr. Young, I think Assistant State's Attorney Caitlin Vargas is going to talk to us about how to get a motion. Is that, are you there?
Yes, I'm here. No, sorry, I jumped in a little bit early. I'm here for the next meeting.
Oh, okay, great. So we'll still figure it out. Okay, thank you.
Thank
Madam
you.
Chair,
You're on the spot.
if I might, Mr. Young, a couple of weeks ago, you had asked about getting resolution for the Public Service
Right.
Committee. So that response I sent you goes into some detail about the process.
Oh, look, yeah.
Steps to go through.
Okay, thanks.
yeah.
Okay.
And now you had another new.
Just one thing,
business.
Everyone is familiar with Robert F. Kennedy Jr. now, probably, right? He's running for president, and he wrote a book called The Real Anthony Fauci. Has anybody seen that book or read it? You should get a copy of it. It'll shock you. But I just want to read a couple things from his book. This is page 23. In May 2020, Dr. Harvey Risch, MD, PhD, published the most comprehensive study to date on HCQ's efficacy against COVID. Risch is Yale University's supereminent professor of epidemiology, an illustrious world authority on the analysis of aggregate clinical data. Dr. Risch concluded that evidence is unequivocal for early and safe use of the HCQ cocktail, which is HCQ, zinc, and Zithromax. Dr. Risch published his work, a meta-analysis reviewing 5 outpatient studies and affiliates with the Johns Hopkins Bloomberg School of Public Health in the American Journal of Epidemiology under the urgent title, Early Outpatient Treatment of Symptomatic High-Risk COVID-19 Patients That Should Be Ramped Up Immediately as Key to Pandemic Crisis. He further demonstrated with specificity that how HCQ's critics, largely funded by Bill Gates and Dr. Tony Fauci, had misinterpreted, misstated, and misreported negative results by employing faulty protocols, most of which showed HCQ efficacy administered without zinc and Zithromax, which were known to be helpful. But their main trick for ensuring that protocols failed was to wait late until the disease process before administering HCQ when it is known to be ineffective. So that's just from his book. And he was just talking about the, there's several pages on the efficacy of HCQ. And then one of the speakers talked about the HCQ. So I just would recommend that people pick up that book and take a look at it, because if we could use those kinds of drugs and promote those kinds of drugs early in the disease, it could actually save lives. Thank you.
Okay, anything else today? Okay, I'd like a motion and a second to adjourn.
Sanchez moves.
William
Sanchez,
seconds.
William seconds. All in favor?